Hello friends, welcome to my channel Dr. Abhinav Kumar MD, which deals with all the issues of hair restoration as well as skin issues. So today we have a patient who has flew all the way from Hyderabad to get his hair restoration done. Our clinic, the Skin Center, Patna. Meet Mr. Suraj Rana Bhatt. Hello sir.
Hello.
Nice meeting you.
Same here. Thank you, doctor.
So you flew all the way from Hyderabad to get a surgery done, which is I think a very big thing for us because we are small at this stage. So why did you choose us?
So actually, I had made up my mind last year for the hair transplant, and the search was going on. I was going to visiting multiple clinics, big, small, just to gain the confidence, just to know how this works. And eventually, one night I was going through reading the Quora post, and I got to know about you and explored more. Got to know about your channel, your work, and that gained the trust. And here I am with you today.
But there are, I think, not less than 50 clinics in Hyderabad alone. True. So why you have to fly such a long distance? What you wanted in your surgery which was missing in other clinics?
Okay, so while choosing a clinic, so I had pretty much few criterias in my mind. So the first one is obviously the doctor, the level of experience and the artistry a doctor carries. That's the first thing, right? And the second was the time. Actually, whenever I visited multiple clinics, and what I found is they get it done in one day without proper planning and without proper suggestions. So that was also one more thing. And the last but not the least, obviously the cost factor as well.
So in Hyderabad, the cost was higher, number one. The planning was not there in most of the clinics, do you think?
True, yes.
True.
And then there's one more thing, which is involvement.
Involvement of doctors.
Involvement of doctor as well as the patient itself. So when you're going with the hair transplant process, you need to know that how much the doctor is available in the entire process, right? So is he just supervisioning, or is he actually playing the key role in the entire surgery?
So doctor's involvement is lacking in hair transplant.
Yes.
So I think hair transplant, especially when you are getting a hairline done, which is the gateway of your face. So hairline has to be as per the facial requirement, your age, your donor, and how your baldness has progressed in the last 10 years. In his mid-30s, we have to also see how much more, you can say, grafts are needed in future for future loss. So we have to take a lot of things in consideration. So planning is a very key component in hair restoration. It is not like that in Sir's case, in which we have created temples and hairline, enhanced his hairline. It is possible in every other case. This has to be decided based on his father's genetics, his own progression over last 10 years, his recession of hairline, what is the available donor in the back of the head and in the beard. So in Sir's case, the beard was poor, only the back of the head was the available donor, and how strong or how much thinning is there in his existing hair. So if he loses in say next 10 years, do we have enough donor to compensate it with another hair transplant in future? So planning, and that is a key aspect of hair transplantation, and a doctor should be spending 2 to 3 hours in the planning of a surgery, because if it goes wrong, everything goes wrong, right? So it is easy to pluck a hair and put it back at some place, but it is if there's no planning, you can overdo a surgery or you can underdo a surgery. So that this planning prevents overdoing as well as underdoing. Second thing, whether I am involved or not. So steps of surgeries include you can say planning, then anesthesia, then hairline designing, then slit making, extraction, and then followed by implantation. So doctor should be involved in at least 3 to 4 steps of the surgery. First is planning, second is anesthesia, third is slit making, and fourth is extraction. If he is not involved in these 4 steps, a lot of things can go wrong, right? So these are the critical steps, and extraction can be done by doctor as well as assistant. So these are the 4 steps. So were we involved in these steps, sir?
Yes, I like the way how it started. So a good level of discussion we had. So obviously, when I was in Hyderabad, we already had a discussion on what will be the procedure. And then when I landed here, there was enough time, entire day also to actually discuss on how should the hair look like, or the hair result should be, right? And the another day was full into I guess slits making.
Yes.
And the entire entire day actually helped me also to rethink if this hairline gonna suit me or not.
You absorb that hairline.
True.
And you absorb the result which can come out of it if it goes all well.
So there was a level of involvement from my side as well, and that was very good, because in most of the clinic you just go and everything will be done in rush, and I think most of the clinic do the entire process, entire surgery in one day.
So we did just around 1800 grafts, and it took us more than in fact 2 days. One half day of planning and 1 full day of surgery, and there was a gap in between because of some issues. So around not less than 1.5 days were taking for doing this small surgery. That ensured that execution on the table was bang on and spot on. Right. So I think we have done the 60% of the surgery. We have done the 60% of the work. Now the 40% is, you can say, that post-op care. Now, which is up to you. So if the team does 60% of the work properly, the rest 40% will automatically fall in line in future, because patient himself knows how much effort has gone into it. So I really hope that you get a good hairline and good results.
Thank
you.
One
more point, you had also consulted a few of the top clinics as well. So what was your experience there?
Yeah, so it's an interesting story. So I actually visited multiple clinics again just to gain confidence, and one of the topmost clinic, what I realized from the reviews and then from the entire process they follow is again the criteria thing. So the doctor involvement was less. The entire thing is done in one single day, and then the proper. I think the lack of planning is also was there. Right.
And maybe multiple surgeries.
And the very big factor is they are charging like 4-5x
of our price.
Of our, yeah.
4-5x of a standard, you can say, price which should be as in Indian conditions, right? So for this level of surgery, so expensive surgeries, but still the doctor involvement is limited,
yes.
Or maybe the most experienced doctor is still not there. Maybe the junior ones are there. Good setup, of course, they have 5-star setup, but maybe multiple surgeries in a day.
And just to add, I think what I heard few of the reviews and YouTube videos is majority of the task is done by the technician. So let's say if you are in a hand of an experienced technician, that's a luck. But let's say if you are in a junior or a newbie,
you cannot allot a technician. So consistent team is very important. A doctor should allot that team whom he trusts in this, rather than randomly allotting a team A into some clinic, this patient team B to another patient team C. So a doctor's involvement is must. If he's not involved, he won't understand the difficulty of the case, and the random technician allotment may not give you the desired result.
Right.
Because some technicians have very high experience, some technicians may not be having that level of. So despite paying such high cost for the brand and you can say a lot of other things, patient ends up not being very happy with the outcome when he gets the results. So that's why I always focus. It's not about the clinic, it's about the doctor and his involvement and his experience and the experience of the team.
Sure.
Which is the key reason, and that's why you have flown all the way from Hyderabad to get a surgery done from me, right?
Yeah, that's right. So the entire, the hair transplant thing I was planning from last year, but then when I got to know about your experience and when I had a talk with you, I instantly made the decision to flew all the way to Patna. So it was a very good experience. The decision was quick, but again it was a very good decision, I'll say, to meet you.
One more question which I would like to add: how to filter a no-glow clinic? But you shouldn't be choosing that clinic at all. So give some points about how to not to go a clinic where hair transplantation is done. Because patients in India, people do Google research, they find 20 clinics on one page in one city, and there's no criteria to filter a no-go clinic. Right? So I think that will help many other patients because you have done your research for 1.5 years.
Right. So based on my experience, the clinic are like mushrooming every day.
Yeah.
So in big cities, there will be like hundreds of clinics. So the very first thing people who are planning for hair transplant should focus on is they should not fall for the advertisement trap. They should actually do their own research, and they should try to find out the work or the experience of that doctor, the past history.
Choosing a doctor.
Choosing a doctor, and then the experience he carries.
Then involving that doctor.
And then involvement
of that.
And then cost and all are the other factors.
So people choose first the cost then a clinic, then a doctor. So it goes the reverse. If you choose the lowest per graph cost or some per graph based on your budget, then you choose a clinic, then you ask who is the doctor.
That's the reason there are a lot of blunders in.
And there are a lot of hair transplant disasters which are coming up and which are coming to us also on a daily basis for repair, and for which they are paying, you can say, the same amount which they have paid for the hair transplant or for a small repair. So why it is happening is because their search has not been proper. They are misguided by, you can say, the team or the marketing people guy, that everything is haily and hearty, right? In that clinic, and a doctor comes, the team comes, and team comes from, say, Mumbai or Hyderabad or Delhi, and they do the surgery, and then rest is taken care of by us. I think when you cannot find a doctor after your surgery, or at least he's not connected to you post transplant, that's a very big red flag. Doctor should be, you can fly to a place, but doctor should be connected to you till you get your results. If Mr. Rana doesn't get a, say, decent result, or there's something missing in his hair transplant, I should be able to correct it. Yeah? So that level of planning should be there, and that level of expertise should be there. That you should be getting an excellent result, but even if you get something less, that should be correctable. That should not be a blunder. So that's how you find a no-blow clinic.
Right.
And this is happening in India, so we want to focus on these things, and it's also happening globally. There's a huge, you can say, black market in hair transplant, or you can say hair mill clinics. Hair mill means the clinic, there are 5 OTs and 1 doctor or 2 doctors, and running 5 OTs together with 5 set of technicians. You may get results, you may not get results, we don't know, but you are paying for a brand or premium. You may get it at a lesser price than us or a slightly higher price than us, but that is not a choice, because it has to be done properly at one go. You cannot keep on getting it corrected every time, and it takes 6 to 8 months to realize that it has gone wrong. So we try to create a beautiful hairline in Sir, and we have to wait for 4 to 6, 8 months to see how it is coming out beautifully. But the planning has been there, so we have done our 100%. Now we have to leave 40 to 50% to God to gift him a beautiful hairline which he has always desired in future. We wish him all the best for his future life, future journey, and future career. And thank you, sir, once again for trusting us and flying and all the way from Hyderabad. Hope we have given you the best hospitality.
The experience was fantastic. I didn't expected this level of hospitality from you and then entire team. Everyone was very cooperative. Everything was superb, and thank you for everything.